Hello, hello. It's Tuesday. It's a couple minutes afternoon for take two for our IG Live today. I just had my second COVID vaccine. I'm a little tiny bit loopy, but we're going to do this anyway and see how it goes. Hey, Bree, thanks for joining. I love seeing you pop up on here. And I'm really excited to chat with Dr. Ann. Hello, hello.
Hi, Kristen.
It's so good to see you.
So nice to see you.
You're one of the people who I've been following along with for a while, and we did that Clubhouse event
Yep.
with Kira, and it was so great to hear more of your story. And I've heard about you from Bree from the Breasties, but the more I read about you, the more impressive and amazing your work sounds like. So I'm just really excited to have you.
Kristen, hold on. Sorry, I'm going to bring this light down while we're talking. Thank you. I know it's been so fun. I feel the same about your stuff. I'm like, I didn't even know your story until Kira introduced us. So it's perfect.
Yeah, I would love to hear a little bit about like your work and your professional story, if you don't mind doing like a little intro.
Yeah, of course. So I am a dual trained breast cancer and breast reconstructive surgeon. So most people have a plastic surgeon and a general breast surgeon. I actually am trained to do both. I'm in private practice in San Francisco. I also co-direct our breast cancer program here at my hospital. So I have a practice mix that's mostly breast reconstruction and breast cancer, and do some general plastic surgery as well.
Yeah, that's awesome. There's probably something to be said for having a doctor who's doing both. And also how much training you must have gone through. How long was school for you?
It's a lot. It's funny. So my husband is dual trained, as he did mostly general surgery and then did plastic surgery and then did a nerve fellowship for these nerve cases we do together. And when I met him, he had been training for 10 years. And so I always feel like the fact that I got out with like 8 to 9 feels like it's still less than 10, but it is a long time. It's great. I mean, it's a practice I always wanted to have, and I really love being on both sides of it, because I think, like you said, the pieces play together. We want to do, of course, the right thing from a cancer standpoint for preventative surgery, but then the reconstructive part of it and the aesthetics of it and even the functional part, it all really plays into it. So I've been really, really excited to get to do both parts.
Yeah, awesome. Well, thank you for dedicating so much time to doing it. One of my closest friends is a pediatric neurologist, and I felt like you give up so much of your life to be a doctor and to specialize, and I don't think most people know what an enormous sacrifice it is to have a calling like that and to have a passion and what you give up to be able to do it and to bring that expertise and specialty. And yours seems so hyper specialized. So thank you for that.
Thank you. Well, it's nice you know what that's like. I mean, I think the good news is, for like most of us as doctors, we really, really like the calling, and the passion for it is very real. And it's nice to have a job that doesn't feel like a job most days. So that part of it is pretty lucky, I think.
Yeah, that's awesome. I would love to hear more about the nerve stuff. I think I have just like the vaguest recollection of talking about sensation at all when I decided to have my mastectomy. And I remember thinking like, oh my God, I don't care. Can we just do this? Like I was so scared.
Yeah.
My mom died in her 40s from metastatic breast cancer once they found the first lump, and it was in the same spot as my mom's primary cancer. I was like, F this, like just take them off. And the idea that somebody would think that I would care, I almost felt like insulted. I'm like, it's the wrong word, but I was like, do you not know why I'm doing this? Like, I don't want to die. This isn't like, oh, I hope my boobs still feel good. But it is, I really grossly underestimated what it was going to be like to live long term. Like, I don't even know how you could prepare somebody for the sort of quality of life long term issues. And so many of them are around sensation. I would love to hear like how you even started thinking about it.
Yeah, I mean, I so appreciate the way that you described how you felt about it when it came up, because we feel that way all the time. I specialize in a kind of lumpectomy surgery called hidden scar surgery, where we try to hide scars to have better outcomes. And routinely people are like, oh, I don't care about my scar. Like, I just want to get my cancer out. I'm like, I totally get that. Like, I want to get your cancer out too. But at some point, all of this fear is going to settle down, and you're going to be left with some disfiguring thing that every day reminds you of having gone through cancer. And so for me, like the sensation part of it is just an extension of how can we get you past thinking about having had breast cancer or having gone through breast cancer risk reducing surgery. But honestly, this all came from my own diagnosis. So, I was like so many people have. I mean, I was 37 years old. So I had a breast lump. I assumed it was going to be a cyst. It didn't go away in a couple weeks. I was like, oh, I'm going to be like my patients. I'm going to be so good and go in and actually get it worked up. And I remember the day I was about to go in and do a huge mastectomy surgery. And the pathologist called me and she's like, Anne, I'm so sorry. It's invasive cancer. And I just like, can't be my pathology. I'm a like 37-year-old vegetarian triathlete with no family history. Like it's again, you hear that story from so many people and that was my story. But I think many people, my genetics were negative, no family history, but many people in my situation, 37, diagnosis out of nowhere, would have had a double mastectomy. But for me, like I knew what that loss of sensation was like. One of my good friends was like, I put on my sports bra and I don't know it's on, so it's like so much more than sensuality and sexuality, which is incredibly important also. But even beyond that, it's functional day-to-day life, like you were saying. So for me, I just couldn't wrap my head around being 37 and coming out of surgery numb. So I had a lymphectomy and oncoplastic surgery with a friend, colleague up in Oregon, flew up for that, came back. And Ziv, my husband, is a nerve surgeon. So all day long, he's around nerves of the head and neck and the extremities. And we're talking and he was like, why can't we repair nerves in the breast the way that we do in the hand or anywhere else? And literally I had surgery in mid-January and we did our first nerve sparing case at the end of February. And it's been, I think we have over 300 at this point. And I was just literally got off a call from a potential patient before this. And I was telling her, like, this is my favorite thing that I do now because it takes a really scary surgery and makes it so much less scary because if many of our patients get back most, if not all of their sensation, and you feel hugs from your family members, you feel all sorts of normal life things. And I think it really allows people to move past it. So yeah, it's been pretty exciting to see. And it's really fun. I was just presenting at a meeting in Miami this weekend, and it's really fun seeing more surgeons interested. Like they get it now. They get that this matters to people, and in hearing your story, like it does matter, and I think a lot of people sort of wrote it off as it was like, oh, sensation, maybe it is, maybe it isn't, but it does matter.
Well, I think, we've been conditioned as women to be really stoic about things like pleasure, especially. And it's multifaceted, right? Pleasure is important, but also like I had a V-neck bathing suit on at the pool with my family and my boob came out and I didn't even know. And my stepmother like yelled. I was like, oh no, what's happening? But I think we weren't allowed to complain about that before and doctors weren't trained to ask.
Totally.
It takes the experience of people who've been through it and understand what that feels like to change it. And what a beautiful thing to do with your husband. Like, it must be so awesome. Like, you're making people's lives so much better together.
Yeah, it's really incredible. And I think, honestly, I often think it's especially incredible, like, given where my story, of having gone through breast cancer, like, I know for him, even being a doctor and being in this space, like, there wasn't a lot he could do to change it, right? Like, I had to wait for my oncotype score to see if I needed chemo, just like everyone else. He had to wait there as a husband, waiting for me to get out of surgery, just like everyone else. And now we do this thing together that makes it so other people don't have to make the same choices for the same reasons that I did. So yeah, it's been pretty amazing. I think like you, right? You find this community you never really, if you would never have chosen to be a part of it, right? Like none of us wanted to be in this place, but then you get to be part of this community that's amazing and really is full of people using their stories to try to make a difference and make the experience better for others, which I know very well. And so I love this unexpected place to have ended up.
Yeah, totally. Somebody just asked you a question about Miami.
I saw that. Sorry, I was giving a conference in Miami. I actually, there is a surgeon there named Dr. Flores, who I know has been doing some neurotization, meaning nerve grafting to the nipples. I've never spoken to him specifically about his practice, but I do know that he's doing it. But my talk was in Miami. It was a big plastic surgery meeting, so he's the only one I know who's doing it. Unfortunately, there aren't a lot of people doing nerve grafting yet. Ziv and I were talking the other day. We've been doing this for over 3 years now, and we just assumed it would pick up more quickly. And I'm seeing little pockets now all across the country of people doing it. But I think it's taken a long time because of the training to do it and the coordination of care. And we have a very unique setup with my being dual trained and his being a neurosurgeon. So it's coming. But
Right.
I know I get asked a lot about people and recommendations across the country. And unfortunately, there just aren't a lot of them yet.
Yeah, I mean, I know a handful of people who've flown to have you specifically for that reason. And it is, you know, I'm sure there's some training setbacks and logistical setbacks and COVID setbacks, but it does
For
feel
sure.
like, you know, these platforms like Instagram and Facebook and how many people are being vocal about their story, I really feel like we're at the precipice of a major tide change, like where women are saying, I want this to happen. I know it can happen, and demanding for better care. And it's really exciting. It's so much, it's like the best thing you can do is to take an experience that you had and make it better for someone else, and that they can then advocate for themselves. And I think the advocating part is so hard.
It's so hard. And I hear this a lot from people. I'm going to be honest, as surgeons, we often are offering options that we know, right? We offer things that we do. And unfortunately, I don't think we do a really good job of offering things that we don't do and suggesting that people go elsewhere. And there are a lot of reasons for that. But the reality is, you know, if you feel like things matter to you, things are important, whether that's going over the muscle or under the muscle or sensation or using your own tissue and not using implants, like a lot of times that takes a lot of advocacy to get there. But I tell people this all the time. You are the only person living in your body, right? Like, I'm not living in your body after the surgery. I'm just going to help you get through it. But years from now, it's your body and it's you. And that's true for all your doctors. And so I think being able to keep in mind, like, what do you need? What are your fears about your body, and communicating them? And it is so hard. I mean, it's especially hard for us as women. I mean, I am 100% sure I didn't mention any of these things to my surgeon because I knew what I wanted and basically was like, here's what I want. But I didn't go into any of them, like why
Right.
I was picking what I was picking and what my choices were. And that was, I do this every day, you know? And so it's really hard for people, but it's so important because it's the rest of your life.
Yeah, it's really important to have that voice, and then to believe that somebody's going to hear you. You know, I had to have a revision surgery. I traveled. Someone asked a question about traveling for surgery.
Oh, yeah.
I did.
Mhm.
I live in Providence, Rhode Island, and I traveled to New York for mine. Traveling definitely makes it harder, but if you have a physician you really want to work with, like, it's totally worth it. But when I had to have a revision, I decided to do it here, and it was such a different process, like talking to a new doctor who was trying to convince me that I wanted bigger breasts than I said I wanted, and
Yeah.
that, you know, like, and I was like, and I feel like I'm okay at this, you know, like I
Yeah.
started this process in 2008, and I've been having to do it for such a long time. And every time it's new, every time it's a new doctor and you say something and they sort of dismiss your opinion or tell you you don't know what you look like or how you're going to feel best, it feels terrible. Like you want to go home and smash something. Like,
Yeah.
I feel so misunderstood in this thing that's so important for me in my body every single day.
Every day.
And you're a person who's going to know me maybe 3 times.
Yeah. No, that's the way you just described that is so powerful. And it's the kind of thing, like, I wish I could save this little part and send it to every surgeon I know, because again, until it's you in that place, it's really hard to get that. It's really hard to get like what your daily life looks like and all the things that you know are going to be impacted by the choices you're making. Like you know, if your body, like you said, you know exactly what changed since your mastectomy, and you know exactly like how it could change with something else. And you're the only person who knows that. And I think the way you put it was so perfect.
Thanks. Well, we have a question here about, can you have nerve surgery after reconstruction? Like, did people like me, and like, I'm assuming the person who asked this question, who've already been through this, is there a way to go back and have something that would improve your sensation? Or what do you do if you're years out?
So the answer is theoretically yes, and we really hope that someday that'll be like a definite yes. But right now, if you do flap reconstruction, which most surgeries in this country are done with implants for mastectomy reconstruction, but if you do flap surgery, you can actually bring a nerve with the flap and connect it in your chest. It's a technique called resensation. That is effective because you can bring a nerve with you with the flap. The problem with implants is you actually need to find a nerve in your chest to connect to, and that's a very unpredictable process. So we've definitely gone back and found nice nerves and done nerve grafting, and it works pretty well. It's not quite as good as from the beginning, but it works. But the problem is you don't know until you get in there, because we don't have a good way yet of looking at nerves. So what I tell people is, if you have a reason to have a revision already, like you want to switch from under to over the muscle, or you need new implants, or you know, something that isn't just fat grafting on the surface, but something where you're going inside, I would definitely ask about it. And that's what we do, is we say, sure, you need a revision anyway, let's go look for nerves, because there's no harm. And if we find them, we will totally reconstruct them. But it's unpredictable right now. But that, in my mind, it's already, I think, such a great, wonderful game changer to offer it at the time. But if we could go back and offer it to people, sensory nerves, you theoretically can connect at any time. So I think that is definitely something that we hope we can do more of.
Yeah, awesome. And it also takes time, from what I understand, like my friends who've had flap, there is a numbness and nerve pain and issues that, like, there's a process before you kind of feel even slightly normal again.
Totally. And that's actually true. And even for people, you know, I always feel awful, like when people find us a month after they've had a mastectomy somewhere else, and they're like, oh my gosh, I wish I'd known. And that always, like, just breaks my heart inside. And I think, though, and I always tell people this, I'm like, lots of people get back sensation in different ways. Not everyone does, but a lot of people, at least, like, you'll feel the edges, or you'll feel the center, or you'll feel something, but that process can take years for some people. So kind of hold out hope that you will continue to get back sensation, even if you don't have a procedure. But definitely if you do, it's a process.
Yeah, it's really interesting. You know, you said something about doctors kind of offering what they know how to do and what they're good at. And I was only offered under the muscle. Oh, of course, also this was almost 10 years ago now.
Yeah.
And, you know, I found out that my doctor had just never done over the muscle. And the animation deformity and the wanting to be physical, and like, I still can't do a push-up. And swimming feels, there's just so many things. And, you know, the thing I've also learned since starting Brilliantly is how much data is missing, and like what an enormous problem it is when data is missing for the changes to happen in the medical community, for training to be better, for processes to be improved, for things to be covered by insurance. There's a physician at the University of Chicago who I think I mentioned to you, Stacey Lindau, who's doing a study on sensation specifically, and she's talking about these things because she met with enough women and was like, okay, this is a problem. There's no research, there's no data, and we can't improve this until we start collecting data. And one of the things that I've been trying to do with Brilliantly, and I'm, you know, like, it's a tiny little platform. There's maybe 2,000 people who are following us, but we try to put out surveys all the time, because the more data that I have, the I can give it to the people who need it. Like, I don't know what I'm going to do. I'm probably going to do nothing with it, but like, if I can give it to someone who can actually make a difference, but maybe can't access patients, or I don't know about you, but like, if I get a survey from a doctor's office or the hospital or whatever, I almost never fill it out. But like, if you called me and you were like, Kristen, could you fill this out? I'm like, hell yeah, I can. There's like a connection that
Totally agree. I totally agree.
It's a totally different thing. And so I think that as we understand the difference between like people collecting bad data and people collecting data that actually can help improve health outcomes, and we get more of that, we're going to see more better changes, for lack of a better phrase.
More better changes. I could not agree more. And I also think, like, it's amazing for me to think about for you and what you're doing and how you're innovating in the space to try to have women, you know, really feel better, right? And I think about that, like you said, the data on what's missing, how are your products going to help innovate and improve that, and then that follow-up on, oh yeah, they really are making a difference. I mean, that's going to be incredible. I always think about how poorly things are reimbursed and covered, like you mentioned, across the spectrum of breast surgery care, and there are so many things that are really parts of supportive care that aren't covered well. And the more information we get that these are making a difference, it only elevates everything, you know? And so I love that you're asking people, because I agree, people are going to be like, I would be thrilled to get a survey from you and then be like, oh yeah, let's answer this and see where it goes. So I love that you're doing that.
Yeah, you know, you mentioned you were an athlete, and we started this corrective exercise program because when I first started Brilliantly, I couldn't get over how many women said to me they still had limited strength and mobility. And I was like, me too. Is that true? Do we all have that? How come no one's fixed this yet? And so we have this program that's like the very first, most minimal kind of like stretching, breathing, thinking about like doing the things that you need to do to even be able to take the next step. And I'm collaborating with a number of other people now about the second version of that program. And first I was like, we need to find out, when do we find people? When did you realize that you should have gone to physical therapy, or that you wished somebody had told you about the restrictions of under the muscle? Or like, when on somebody's journey are they ready to hear these different things? And then how do we find them? Like, there's so many parts of it that are tricky.
And I like everything, I just in my head, every single thing you said, I was like, yes, yes, and more yes, because so many people, I mean, everyone should go, or at least have the option of going to physical therapy after any kind of involved breast surgery. It's a thing. Everyone should have that. And so many people don't go. And like you said, there's so many things you don't know what you don't know. So there's so many things you just assume that's normal. Like, oh yeah, the way that I feel, the tightness that I have, all of that's just normal. It's just part of having surgery. It's like, but it doesn't have to be normal, but you need to have someone tell you that that isn't normal for you to even realize that you don't have to live with that, you know? And I think the exercise part, physical therapy, and there's so many great things online now. I mean, I communicate back and forth with people on social media who are physical therapists, and they're putting together really amazing programs for women to do from, their house, that make a huge difference in terms of mobility.
Yeah. And I think that's such a huge part, right? Access. Like, we're talking about all these things, but really the underlying factor, even if people knew about it and we reached them in the time when they wanted and were ready to receive that information, then like, do you have the time off work? Do you have the childcare? Do you have the ride to get there? Is it close by? And that so many things are happening online now that you can be home in the like 20 minutes before your kids go to bed, before you pass out, and be like, I'm going to do this thing for myself. I want to feel better, and I'm going to do the work to do it. Somebody just said, is there a specific type of PT to receive? Oh, maybe you can answer this better.
No, Kristen, you have it. You answer first. You got information too.
Yeah, the physical therapist that I went to, and I had to push hard to get a prescription for it, which also felt really annoying, was someone who works at the Women and Infants Hospital here in Providence. Like, it was her focus was women who'd had breast surgery. And I also found a woman who did myofascial release massage that had worked on lots of women who'd had breast surgery, because the muscles connecting to my sternum spasmed for years. Like, it was just a thing. Like, I could watch it, I'd look down and be like, oh, my boobs are dancing. But are people specifically trained to be physical therapists for breast surgery?
There are. So the main reason where physical therapists were coming into the breast surgery space initially was about lymphedema management. And so there are lots of people who are trained to do lymphatic massage, give you information. And I actually think most people, certainly anyone who's had any lymph node surgery, would really benefit from seeing someone who knows what to look out for. Lymphedema, fortunately, is fairly rare now, but you still want to have someone who can give you lymphatic massage, tell you about warning signs and things like that. So like where you went, a cancer center that does breast is always a great place to start. But we have a number of programs here in San Francisco, similar to the rest of the country, that are people, like you said, they may not necessarily be doing lymphedema, but they're doing myofascial release. They're doing stretching, strengthening in the breast space, and they understand implants. They understand, like, if you're getting early capsular contracture, how do we get involved? What does under the muscle mean? What are your restrictions? And so I would strongly recommend starting with someone that this is what they do day in and day out. And a lot of times you can go take what you learn and take it back home. So like you said, it's hard enough to get in person, but you get programs to take it home, even if you go in person for a few times.
Yeah, that's awesome. We're getting a whole bunch of questions. The other thing I just want to add on is that use these communities. Like, I get questions from women all the time that are like, hey, would you mind posting, I am doing egg harvesting and I have like a specific question about whatever. Like, any one of us who has a platform will put your questions out for you if you feel like your followers aren't primarily in the breast cancer space, because I think getting recommendations and hearing someone else's experience, even if it's bad and they're like, I should have asked this and that, is really helpful too.
I love that. And also for everyone who may be putting questions on, if we don't get to it before Kristen and I finish, you can totally feel free to DM me. I try to answer questions semi-regularly and I'm trying to be good at it. So, but I love hearing questions. I did see one on there about surgeons doing nerves in Ohio, and you are actually one of the very lucky few people who live somewhere besides San Francisco where they do it. So Cleveland Clinic The surgeon's last name is Johan. It's Djohan. I can put it in the chat in a little bit too. But Cleveland Clinic is actually the other big center besides us doing with implants. So
Awesome.
that's a great choice for people coming from that part of the country.
Do you know, is there like a database or a place that people can go to look for surgeons who do specific kinds of surgery?
So I dream about that as one of the many projects that I have in my head. The reality is we really don't have that other than kind of individual websites, and a lot of the plastic surgery databases don't have that level. There is, though, the site Resensation, which is that technique with flaps. They actually have surgeons who are trained in the technique on their website. So I do recommend people go to that, because the hope is that if it's someone that does it with flaps, if someone's going to start doing with implants, it might be them. Or if you want to have flap surgery, then that would be with them. So I would go to resensation.com, and that's a good place to start.
Awesome. Super helpful. And then when is the right time to start PT?
Oh, yeah. So my caveat for this is always clear it with your surgeon, because different people have different things going on. I think usually we're talking about the 2-week mark is when most surgeons feel comfortable. But you can start doing, at least in our practice, lower body exercise and kind of getting active in about a week after surgery. But for stuff like really lymphatic massage, drainage, lots of arm movements, it's usually about 2 weeks for most people.
Yeah, awesome. And I think that's a good disclaimer. Always ask your surgeon. It's hard.
Always
There's not
ask
ever
your
a universal
surgeons.
answer. But
Yeah.
I think, you know, the universal answer is moving your body helps you feel better. So even if it's just taking a walk.
And walking is so good. And I think, you know, it's really important to know, like, everyone's healing and process is different. So I think it's important to move, but it's also important to know, like, whatever you can handle is whatever you can do. And that's good enough, because some people are, you know, bouncing off wherever at 2 weeks, and other people just aren't ready for that yet. And all of that is okay. They do have really good data that show that exercise actually decreases the chance of recurrence. If you have breast cancer, it's pretty amazing. It's almost as good as chemo in some certain circumstances. So I will say, if you are someone who's had breast cancer, I think whatever that activity looks like, whenever you're ready, if it's, you know, if you're having chemo and you're not ready, that's okay too. But whenever you're ready, moving your body is so key for recurrence also.
Yeah, awesome. Well, Anne, what's the best place for people to follow along? I know you're quite active on Instagram, and you've been doing more things on Clubhouse, but is there another way for people to like follow along and stay in touch?
Oh, thanks. I think if people go, Instagram's usually the best idea. We do have a newsletter as well that you can sign up for on our website, which is just annepeledmd.com. And we try to talk about a lot of different things, but Instagram's my favorite. And then, yeah, Clubhouse has been so fun. I'm really excited to get you back on and start doing that, because I think it's a really open space for people to talk. But again, always happy to answer questions, and these kind of forums are so perfect for people to jump in. So I really appreciate your having me today, Kristen. Thank you so much.
Thank you so much for the time. I really loved chatting with you, and I'm looking forward to continuing the conversation and you know, just seeing how it goes. Thank you so much for all your amazing work in the space and taking care of some of my favorite people.
Thank you. I feel the same way, Kristen, and I follow along with your products so much, because I keep being like, oh, when do we get to try them? So
I'll ping you offline, but I have some production quality units I just got in. I should just send you some. So
yeah, that would be great. Yes, I want to talk about it. I'm so excited about it.
All right, well, take good care. Have a wonderful day, and we'll talk soon.
Thanks. So good seeing you, Kristen. Bye.